destiny. Oh, it's my day to do anything I want to. It's my time, and I'll use it any way I want to. It's my life.
Hello, everyone. Welcome back to Health Check on Newstalk 93 FM. I'm Sudine, and today we have a very insightful conversation lined up as we discuss infection prevention and control with our special guest, Dr. Yohann White. Dr. White is a dedicated public health advocate, media strategist, and expert in infection prevention and control. He has played a crucial role in public health communication, ensuring that critical health information is accessible and impactful. Dr. White has extensive experience in developing health campaigns and infection control strategies, and he has worked closely with communities and organizations to promote better health practices and curb the spread of infections. Thank you for joining us.
Thank you for having me. Pleasure to be here.
All right, Dr. White. So can you start by giving us a brief overview of what infection prevention and control entails and why it's such an essential field in public health?
Certainly. It's actually a very broad umbrella of different disciplines that are aimed at preventing infections or germs, and if they do occur, containing those infections. So broadly, we could define infection prevention and control as a multidisciplinary, evidence-based practice that encompasses administrative, procedural, technical, and communication skills with the objective of detecting infections early, containing them when they do occur, and preventing the spread of infection. And that is not restricted to just healthcare workers. It involves patients. So patient safety is a very big component, but it also involves those who are visiting patients in an institutional setting and any other stakeholders who may be a part of that ecosystem. So visitors, family members, and when we talk about healthcare workers, we're not just talking about medical doctors, but nurses, persons who work in the sterilization unit, support staff, everybody who's a part of the healthcare worker community.
Thank you so much for providing that important context. So many people might not be aware of the various careers in health that contribute to infection control. What are some of the key roles in this field, and how can someone pursue a career in this area?
Yes, it is a broad field, which means that it relies on multiple disciplines, and all of these different disciplines complement each other, because we've talked about procedures like standard operating procedures. So it really requires somebody with an attention to detail, with technical expertise that is good at communication and documenting. So that speaks to one particular role. Then there is messaging. How do you get healthcare workers and patients and family members to comply with a certain desired behavior? So you're talking about behavior change and health promotion and communication. So that is another angle from which personnel could come, or somebody who's interested in a career in infection prevention and control. But there are also very technical aspects that are related to laboratory work, so microbiology or the microbiologist, and that's a person who is specialized in germs, basically. So investigating germs in the laboratory setting to see if a patient has a particular infection, and then determining what medications or antibiotics or antivirals are most appropriate. So a microbiologist is another person. Microbiologists are supported by medical technologists in the laboratory, who are persons who are specialized in laboratory procedures for doing certain technical things in the laboratory. But even if you're coming from a specific specialization, all of these persons that I've mentioned usually pursue infection prevention control training programs, because a training program in IPC or infection prevention and control brings it all together. It reminds us of why we're doing this. It reminds us of the team approach. It reminds us of the leadership role of a focal point, an IPC focal point, so somebody who, beyond their initial technical specialization, also pursues even deeper and deeper knowledge in IPC. They pursue specific training programs, certification programs. The United States Certification Board in Infection Control has a world-renowned program that is respected everywhere. It takes a lot of preparation, but once you are certified in that area, then anybody who meets you and knows that you've done this program understand your background and that you've gone deeper and not just a superficial approach to what you're doing. And importantly, like anything else in any field, it's about lifelong learning. So you don't just do a certification exam today and expect that is the end of it. It's really just establishes a base for you and gives you a sort of set of guideposts to direct your own learning. You're going to read or research papers in the field, what interventions are most effective in promoting patient safety, in preventing spread of infections in hospital, in preventing healthcare workers from carrying germs on their hands, etc.
Okay, so what I can hear from what you're saying is that infection prevention and control, the principles and the subject matter, the knowledge, it's important for virtually anybody in healthcare. And it can be, the information can be applicable and useful to any field of study, any role within the healthcare industry. Yeah, you feel like that's an accurate way to look at it?
Yes. In a nutshell, infection prevention and control is everybody's business, and everybody has a role to play. It is enhanced and made more effective when there's a focal point or a lead who helps to coordinate other team members and helps to lead the communication. But in fact, it is everybody's business. And one thing I'd like to emphasize is that the backbone, or one of the most critical pillars of infection prevention and control, is data. Data, the use of data. So it's really important to know what your baseline is, how many types of a specific type of infection is happening in your unit or on your ward or in your institution, because if you don't know the baseline, you will not know when there is impending trouble. When is there an uptick? When have my systems started to break down? When do I need to do an intervention? So if you don't have that ongoing collection or surveillance of data, then you will not be able to tell when you're in trouble or about to get in trouble. And as it turns out, my experience has mostly been in data. From a research background, I've been a part of teams that help with clinical trials, internationally. My role is usually to do with the laboratory, and I will get, certain specimens to process, and it all feeds into the team's results in terms of the clinical trial reports. But I've also written and organized a number of studies around a number of issues. So I have an interest in data, and one of the things that attracted me to IPC, and in particular the certification in infection control with the Certification Board of Infection and Control and Epidemiology in the US, is that when you're reading their literature and their materials, it just keeps talking about data and the importance of data and an evidence base. And, in their literature, every sentence virtually is supported in parentheses by a reference, a study that was done, or some form of data. And I think that really resonated with me. And that is one of the reasons I sought to even get deeper into IPC. So data is really central part of it. Mhm.
Thank you for sharing that with me. So, as we talk about IPC careers and how broad of a field it is, what kind of professionals does the field need right now?
Yes, right now it needs everybody, but as
Mhm.
I've mentioned, IPC is really everybody's business, but it would benefit from more focal point persons, more coordinators. So these are persons who, yes, you have your basic training. Yes, you're a registered nurse. Yes, you're a microbiologist. Yes, you're a surgeon. Yes, you're an internist. So you have your technical base, but you've now recognized that, hey, I want to have a bigger impact on quality of care, on patient safety. I want my impact to be more system wide.
Mhm.
And for that, uh, pursuing further studies in IPC through professional courses and certification examinations will help you to do that because it gives you additional skills in terms of your being able to use data to make decisions, use data to diagnose when there's a systemic problem. And it also helps you to describe what challenges you may be having in your healthcare environment and to come up with interventions through a team approach to solve those issues and to document them. So it really needs persons who are willing to now go the extra mile to
Mhm.
pursue specific studies or additional work in IPC. So these are courses that are prepared to take you from your specialist area and build on that and to have you contribute to a team approach to have a more system-wide impact.
Understood, understood. Want to ask you about the COVID-19 pandemic particularly. I presume that that period of history brought infection prevention to the forefront, and how I assume it must have really impacted how we practice healthcare. So, what lessons do you think we've learned from that, and how can they be applied to future event infection rather prevention control methodology?
Yes, that was certainly a lesson for all of humanity.
Yes.
But COVID in particular, which is caused, well, COVID is a disease resulting from infection with the SARS-CoV-2 virus. So severe acute respiratory syndrome, coronavirus 2. So that is the infection, and COVID is the disease.
Right.
So even that simple fact, I think, took a while to be clear in persons' minds because what it demonstrated is that you can have an infection and have no symptoms, right? And initially with COVID, that wasn't clear, not even to scientists really, because there's a perception that if you have an infection, it means you should be symptomatic, and therefore, only if you're symptomatic are you a threat to other persons. But we eventually learned that you can be symptomatic, have no symptoms at the time, but you're still able to pass on infection to persons. And some of those persons may be extremely vulnerable and may not do as well as you were able to do in terms of not showing any symptoms. I think asymptomatic infection or just infection without symptoms was one of the principles that I think eventually came out. And it's not unique to COVID. There are a number of other diseases that behave that way. There are diseases where virtually everybody who gets an infection typically has symptoms like, say, measles, for example, and they look very ill. But there are most diseases, perhaps you can have an infection and not yet have symptoms and you can still pass it on. So I think that was a basic principle because then now, if you're able to identify those persons with infection through testing,
Mhm.
you can isolate those individuals. and you can prevent them from passing it on to another person. So those two principles, that you can have an infection and spread it without having symptoms yourself, and two, the principle of detecting and isolating infected persons so that they don't pass on infection to other persons. There are a number of other things that came to the fore. For example, the role of vaccination, and the importance of communication around that. The perception, even among healthcare workers, is that once you get a vaccine, you should be 100% protected.
Yes.
But if you really think about the vaccines that are available, we do know that being vaccinated does not necessarily mean you will not pick up the germ.
Yes.
What it means is that it decreases your chance of picking up the germ, yes. But secondly, if you do pick up the germ after being vaccinated, you tend to have milder disease, and you tend to not have to be admitted to hospital. And certainly it significantly reduces your risk of dying. And I think because of there are a lot of misperceptions about how vaccines work. And I think that communication gap did not help. It made the situation more challenging. But I think coming out of that, persons, I think, have a better understanding. Because if you think about the influenza virus, for example, there is a vaccine against the influenza virus, or the flu, what we call the flu.
Right.
And as healthcare providers, we promote the use of the flu vaccine, which is something that is done on an annual basis. But you will hear patients complain, even healthcare workers say, oh, I got the flu vaccine, but I still got the flu.
Yes.
But we have to remind persons, even before giving them the vaccine, so they can weigh the pros and cons, that getting a vaccine does not necessarily mean you will be 100% protected from getting the germ. What it means is that it reduces your risk of getting the germ. And secondly, if you do get the germ, it usually means milder disease, decreased risk of being admitted to hospital, and certainly a decreased risk of dying. So those are, I think, are the biggest lessons, I believe, coming out of the COVID pandemic.
Thank you so much. Before we wrap up, I want to let our listeners know that we will continue to have conversations about infection prevention and control in future shows. But I want you, Dr. White, in 60 seconds to tell our listeners what you want them to take away from this conversation and move into their lives, whether as patients or for any healthcare providers who are listening to it. 60 seconds.
Absolutely. Infection prevention and control is everybody's business. Healthcare workers, patients, family members, and visitors of patients. And everybody has a role to play. If you're a healthcare worker, you can pursue deeper studies in infection prevention and control. If you're a patient or general public member, take your antibiotics appropriately. Only take antibiotics that are prescribed for you. Take them until they're finished so that you can kill all the germs and they don't bounce back with vengeance. Get your vaccines for the various diseases that are out there, measles, influenza, COVID, and talk with your healthcare providers if you have any concerns, whether you believe that the vaccine will not protect you. I think just by raising that concern with your healthcare provider will provide an opportunity for them to discuss with you the pros and cons of being vaccinated. So healthcare workers, patients, visitors, everybody has a role to play in infection prevention and control.
Thank you so much, Dr. White, for sharing such valuable insights on the field. This conversation was very, very, very enlightening, and I hope we get to, speak more about the issue because it's such a broad topic. All right. To our listeners, thank you again for tuning in to Health Check. Stay tuned. We'll be right back.
Hey, give thanks.